All right. We are very happy to be joined this morning by Brian Fields. We all know Brian. Brian's been here before speaking. Brian is the guy who puts those great PA Atheist Humanist conferences together that many of us have enjoyed. He's the president of PA Nonbelievers, still correct? And he's the co-chair of the Secular Coalition for Pennsylvania, correct? Still correct, awesome. So Brian is here and he's going to talk to us about Secular Coalition for America's new project that they have, Put Kids First. Okay, so with no further ado, I'd like to welcome up to the stage Brian Fields.
My own? There we go. Thank you, Darren. And thank you for having me today. I'm just pulling my speech up real quick. Here it is. How y'all doing? Yeah. For those who don't know me, I'm Brian Fields, and I'm here on behalf of the Secular Coalition for Pennsylvania today. I often wear multiple hats. I don't know why. They just keep falling on my head. But so today I am specifically here on behalf of the Secular Coalition for Pennsylvania, which is the state chapter of the Secular Coalition for America. The Secular Coalition for Pennsylvania is the lobbyists that work for you here in Pennsylvania in the state capitol. The Secular Coalition for America, they're your lobbyists in Washington, D.C. They lobby Congress and the administration and try to protect the secular character of our government and work to bring visibility and respect to secular Americans. Here in Pennsylvania, we lobbied against the In God We Trust thing that they tried to do, where they tried to put In God We Trust in all the classrooms. And that one's been backburnered in a committee, which is really good. And we're always looking out for problematic legislation and things that affect all of us. Go ahead, actually twice. First, let's go back one. All right, here's the contact information if you ever need to get a hold of us or want to work with us. pa.secular.org, that second link on the screen. That is a URL. You can type that right in your browser. You can join up and sign up for action alerts, and we really encourage everybody to do that. We also have a monthly phone meeting, so we really want you all to get involved with that if you can. Go ahead on the next slide. One of the ways you can help us is by signing up for those action alerts. You can do that online at that website, or by giving me your email address today. I'll have some vaccine pledge a form that you can fill out. And we track and monitor the state legislation, and any time that something comes through where we need local support, we'll send out these alerts and let you know what's going on so that you can contact your local representatives and let them know how secular Americans feel about those types of issues. And we don't just oppose legislation, we also support legislation. I'm going to talk a little bit about that today. But I can't stress enough how important this is. Since so few people contact their representatives ever, too often a vocal minority will get its way by making a lot of noise because legislators aren't hearing from any other constituents. Religious organizations seeking to insert their beliefs into state policy are particularly vocal and well organized, which is why we often see ideologically motivated legislation. The squeaky wheel always gets the grease. If I have a meeting with a state senator and I tell him or her the secular community supports this issue, and then we send out an action alert, if folks aren't filling these out and then we look like we don't have a whole lot of people behind us. We need your voice to help us build political influence proportionate to our numbers, and our numbers are actually very impressive and growing. In 2014, the percentage of unaffiliated Americans increased to 22.8% from 16.1% in 2007. 21% of Pennsylvanians currently identify as religiously unaffiliated. Next slide. This is more information on the religious makeup of Pennsylvania, and you can see the unaffiliated number right here. But notice this little orange block here, there aren't too many other blocks that are that big. We're not small. Okay, go ahead and Next slide. Filling out an action alert takes less than 2 minutes, and opt into saving your information so that the next time you fill one out, it can take just 20 seconds or less. The more people we have take time to do this, the more impact we have. Now that I've told you a little bit about the Secular Coalition of Pennsylvania, I'm going to talk to you about an opportunity to get involved in this new campaign called Put Kids First. It's a legislative initiative to repeal non-medical vaccine exemptions state by state, including right here in Pennsylvania. Next slide. There are 3 types of vaccine exemptions: medical, religious, and philosophical, which are also referred to as personal belief exemptions. Medical exemptions are for people who have legitimate medical reasons why they can't vaccinate, such as children who are too young, people with immunodeficiencies, cancer patients undergoing chemotherapy, and other conditions that can be verified by a doctor. People with medical exemptions are the most vulnerable to contracting vaccine-preventable diseases, like measles and whooping cough. They depend on the healthy people around them to be vaccinated, a concept called herd immunity that you may have heard of before. The problem is that a number of people using non-medical exemptions has increased in recent years, leading to outbreaks of vaccine-preventable diseases like the measles outbreak in Disneyland a little bit ago. Vaccine-preventable diseases are making a comeback. Just to give you an idea of the scale of this problem, let's take a look at the numbers. In 1975, there were 1,738 cases of pertussis. But in 2014, there are nearly 30 times that many cases at 28,660. In 2012, there were 229 cases of mumps, but in 2014, 5 times as many cases, 1,151 were confirmed, and measles has merely tripled from 188 to 644 cases confirmed. Right now, 47 states and Washington, D.C. have non-medical exemptions on the books. This summer, the Secular Coalition for California helped repeal California's non-medical vaccine exemptions. In California, where they've been fighting really hard, there's a strong anti-vax movement. They succeeded in repealing the non-medical exemptions. As a member of a coalition of a large number of groups, not just the secular community, but members of the medical community and so on and so forth, all work together to make that happen. As the coalition was called Vaccinate California. And California, Mississippi, and West Virginia are now the only 3 states adequately protecting their citizens from these diseases by only allowing medical exemptions. Next slide. Well, where does Pennsylvania stand? As you can see on the slide here, this is a breakdown of the number of exemptions for the 2013 to 2014 school year. In that school year, we had 510 actual medical exemptions. That's that really small block for those who can't see in the back. The rest of them were non-medical vaccine exemptions. Many outbreaks of vaccine-preventable diseases like measles can be linked to states that allow for non-medical exemptions. As of 1978, Pennsylvania allows both religious and philosophical exemptions. To attain an exemption, a parent just has to object in writing on religious grounds or the basis of a strong moral and ethical conviction. That means they just take a piece of paper and say, I have a religious conviction. They sign it and they hand it to the school. That's all they got to do. And as I pointed out, this is where we stand today. Go ahead and do the next slide. As a result, disease comebacks in Pennsylvania. We have 772 cases of whooping cough, 1 case of measles, and 17 cases of mumps in 2014. There was a bill called SB 407 that's still kind of batting around committee, but it would work to increase the awareness and availability of the flu vaccine. And Pennsylvania has one of the top 5 lowest vaccination rates in the country. Next slide. So why are vaccines a secular issue? As a secular advocacy organization, we are dedicated to both defending the separation of church and state and advancing evidence and science-based policies. This is an issue that touches on both. The bottom line is that vaccines work, and there's overwhelming supporting evidence for this. The growing number of people opting out of vaccines is reflected in a growing distrust of science. But with children and vulnerable community members out there depending on the people around them for protection, immunization is an issue where we cannot allow people to disregard evidence at the expense of other people's lives. Parents' religious beliefs do not give them license to put their children, other children, and the community at whole at risk. Non-medical exemptions put those who cannot be vaccinated, like infants and children with certain medical conditions, at risk of deadly and highly contagious diseases. Vaccine policies should be based on evidence and science, period. With states like Pennsylvania having non-medical exemptions on the books, our government is putting us all at risk for an outbreak for the sake of letting people choose to deny science. The secular community must stand up and demand that these policies meant to protect everyone put public safety before personal and religious beliefs. In all the states that have both religious and philosophical exemptions, people more often use the philosophical one. What this leads us to believe is that in states with only a religious exemption, those who reject science but do not have an actual religious exemption are taking advantage of the religious exemption, using it to justify it as a denial of science that puts their children, other children, and community in harm's way. A disturbing trend we are seeing is that legislators in states like Maine, Pennsylvania, and Washington, in response to the immunization crisis, they have introduced bills that would repeal only the philosophical exemption, while leaving the religious one intact. This not only fails to solve the immunization crisis, as those who are determined to opt out will claim a religious exemption instead. It also puts government in the business of distinguishing unscientific religious beliefs from unscientific non-religious beliefs, giving an exemption to the former but not the latter. You can see how this brings the government into unconstitutional territory when it comes to keeping government out of religion. For example, Vermont recently repealed its philosophical exemption and left the religious one in place. There's now a group of anti-vaccine parents in Vermont considering starting a new religion so they can opt out of immunizations. In Illinois, a law was recently enacted which leaves it up to local public officials to verify whether or not the content of a parent's certificate of religious exemption is valid or not, essentially making public school officials the arbiters of religion. The best way to protect both the separation of church and state and advanced science-based vaccine policy is to repeal all non-medical exemptions in every state. Policies that affect all Americans must be religiously neutral and evidence-based. The government has a responsibility to protect public health, especially in taxpayer-funded institutions like public schools. We are calling on the secular community to stand up against a majority of the vaccine policies throughout the United States that accommodate the ideological beliefs at the expense of children's safety and public health. Good, next slide. We can roll back non-medical vaccine exemptions. California, a state with one of the highest non-medical exemption rates, was able to roll back its non-medical vaccinations this summer, despite having a strong and well-funded anti-vaccine movement. After SB 277 passed and was signed by Governor Brown this summer, thanks to the advocacy efforts of the Secular Coalition for California and its partners in Vaccinate California, the anti-vaccine movement tried to put a referendum on the ballot for the next election to repeal the new law. They failed to get enough signatures. This is an issue that has broad public support. According to a Reuters Ipsos poll, 78% of Americans believe that all children should be vaccinated. It is also an opportunity for the secular community to demonstrate why secular values, why evidence and science-based policy are good for everyone. That we stand for issues that all Americans of faith and none can get behind. This is an issue we can work on with parents, with the medical community, and with the pro-vaccinate faith communities. This is an issue we can win. Right now, we're getting the word out. We're contacting local groups like the Lehigh Valley Humanists, and soon we'll be reaching out to legislators, and we hope you can work with us. Next slide. This is the card I don't have with me today, but I have an online form I'll have you guys fill out if you're interested in getting involved that has all of this information on it. By filling out this information, you can make a big difference. When we lobby to repeal Pennsylvania's non-medical exemptions, we need to make sure that those meetings are followed up with emails, phone calls, and local letters to the editor so that we can show these legislators that their constituents support this issue. That way, we can make an even bigger impact by elevating the voices of constituents who also happen to be parents, people with medical reasons why they can't vaccinate, medical professionals, and people who work in public schools. Next slide. If you have a child less than 12 months old who cannot be vaccinated, the best way you can make an impact is indicated on the pledge card and giving us your contact information. That way, if we just had a conversation with your elected official, we will call you and ask you to give their office a call and let them know that your constituent who is directly impacted by Pennsylvania's vaccination laws. You will also see that you can indicate that if you're social media savvy, would be willing to do phone banking, and if you'd be willing to advocate to your legislators in person. By social media savvy, we generally mean that you use social media like Facebook and Twitter on a regular basis and are comfortable doing so. We can use help getting the word out about the campaign and getting the members of the community to speak out by participating in action alerts. For the phone banking option, we will be asking volunteers to call others who have filled out the pledge card when we really need them to contact their legislators. So for example, say there's a legislator who's on the fence about co-sponsoring the legislation we are advocating for, and we send out an action alert, but no one does the action alert. Then we might ask you to call 10 people who signed the pledge cards, and so that they will know what you're talking about when you call, remind them to contact the office. I can't stress enough how little things like this make a huge impact. When legislators hear from their secular constituents, they are far more likely to work with us. We need you to speak out as an individual, making that call, sending a letter, to flex our political secular muscle. Research has shown that more than any other type of constituent communication, in-person meetings have by far the most influence. If you are willing to speak to your state representative in person, please indicate that on the card. We are more than happy to help you schedule a meeting, prepare for it so that you will know what to expect and feel comfortable, and attend with you so we can bring supporting materials to leave behind with the staff. If you can't lend your time to the cause, the best way you can help us out is to make sure our work is possible. The Put Kids First campaign is funded by the Secular Coalition for America, a nonprofit organization that runs entirely on private donations from individuals like you. They help support our state chapter and work hard to make sure your voice is heard in government. By pledging a donation to Put Kids First campaign, you can help ensure that we continue this important work. Next slide. Before you leave, please see me and fill out the form for the pledge cards, and you can find out more about the campaign on secular.org/put-kids-first, and more about the Secular Coalition for America at secular.org. Thank you so much for having me today. Yeah, I can take questions. Yes. I think you can steal Darren's.
Is it working? Yes. All right. I'm going to regret doing this. Sorry. My name is Stephen Katz. I'm a pediatrician since 1976. If you have any questions about any aspect of immunization, the diseases, the side effects, I teach this stuff as well as practice it. So I have the anecdotes, but I also have the information.
And people that are vaccinated carry the disease to, infect others?
Depends on the disease. So for example, all of us carry the varicella virus, chickenpox, and that's how you get zoster. So, if you're not with an active chickenpox or an active zoster lesion, you're not spreading anything and you're immune. The classic case right now is pertussis, whooping cough. We changed our vaccine some years ago, I think it was in the 90s, from a whole cell vaccine that was very immunogenic and very effective. Natural pertussis gives about 13 years of immunity, and that would be the cycle of outbreaks. The vaccine gave about 10 years of immunity. So you needed boosters, or you needed the population immunized. Due to the side effects of the whole cell vaccine, which included high fevers, irritable cry, and rarely and debatably neurologic impairment. That vaccine was changed to what's called the acellular pertussis vaccine, which has only 3 or 4 antigens rather than thousands. The safety factor went up greatly. Kids do not have the fever, irritable cry, etc. that they used to have. But the vaccine is not effective, so the vaccine now prevents symptoms of pertussis. You don't get the bad cough, etc. But the virus can still spread in the community and spread to others. So yes, even though you get the pertussis vaccine, pertussis is still circulating in the community because it's less effective in diminishing the carrier state and the spread of the illness. I get really technical.
The danger for parents that don't allow their kids to be immunized, is it mostly on those kids?
Well, it's both. In other words, if you don't have your child immunized, so we can take pertussis as an example, but we could pick any disease, quite honestly. So if you don't get your child immunized against pertussis, your child is at risk of getting pertussis. That's a big issue for us in the children under a year of age because that's when pertussis is most serious and can be most fatal. And we give pertussis vaccine at ages 2 months, 4 months, and 6 months, and the children really don't develop protection until they're around 6 to 8 months old. Those first months, they're susceptible. So if you don't immunize your child, that child is more susceptible. If the 2-year-old and 3-year-old and 7-year-old and 14-year-old in the household are not immunized, that infant is susceptible.
Herd immunity.
If you want to protect the infant, the best thing that can be done is you immunize the mother during pregnancy because our new immunization only has about a 3 to 5 year efficacy before it really starts to wane off. And if the mother says, I don't want myself immunized, that puts her child at greater risk. Now, if those kids are now spreading pertussis, whether they're symptomatic or not, how does that affect other people? And if you're only talking about kids in the public school, I have to tell you that many kids have social interactions outside of school. And the bacteria, pertussis, is not saying, oh, school, not school. You know, it spreads. So,
and that's actually even worse because we're talking about, when it comes to vaccinations and vaccination laws, they usually refer to admitting your child to public school. There's no law, especially if you're homeschooling, that requires you to vaccinate your children for your homeschool children, which means that that is an option for some parents, even with the current laws on the books. If they homeschool, they're completely outside of the system. And now you're talking about let's all go to the playground, especially homeschool kids. They usually have the play dates at the playground where your child might be playing and they have no immunizations whatsoever. So this is a big problem. To handle questioning, I just want to, no, it's fine. That's fine. I just want to say, if you have questions about the Secular Coalition or the Put Kids First program, feel free to direct them to me. If you have questions about vaccinations or the science behind the vaccinations, I guess you'll take them. So, just.
Brian, is the Secular Coalition working with other organizations on this initiative?
We're building our grassroots support right now. It's our next step is to go out and work. Actually, it's a task on my list to identify organizations in Pennsylvania we can work with. There was an attempt a year or two ago to work with, I'm blanking on his name, one of the representatives in central Pennsylvania on vaccinations, but it only was working to repeal the philosophical exemption, was not working on the religious exemption, and it failed. And that was a coalition. We're hoping we can do it better. Yes.
Start with, vaccinations are required by law,
To attend public school.
and then to get out of having that done, you have to register your
You have to take a piece of paper and write, I have a philosophical objection to vaccinations, or I have a religious objection to vaccinations. Sign it and turn it into your school.
Next thing is that recorded anywhere? Documented, this exemption?
When you go to attend school, you're supposed to provide some documentation of your vaccinations. So you have to provide either the vaccination record copy from your doctor to the school or the exemption. So that's recorded in the public school district.
Where I'm trying to go with this is, can you go backwards and look at all these cases and say, all these people who had exemptions are Catholics? I don't know, religious?
You're not required to identify which particular religion or what you don't have to justify the exemption. So it would be very difficult to get accurate information. I'm not sure. I'm not sure what the use of that would be.
With the religious exemption and they're all getting sick, there's a correlation there. Doesn't matter what religion, it's just if they're using religion to get out of having the vaccinations, yet those children come down sick, isn't there a correlation?
Well,
There is in limited community outbreaks, like a commune of Amish or, some other isolated group. Then you can say, all right, that group had a very low immunization group and had the outbreak of disease.
Right.
But, only in those cluster.
And here in Pennsylvania, it's often the Amish. I know you're over there. It's often the Amish and that do object on religious grounds. When you saw the slide up, though, the vast majority of objections here in Pennsylvania are philosophical rather than religious.
We're going to do one more question. Are you going to stay for lunch?
I can hang out a little bit, but I'm not going to.
Okay. So if you have to do the one,
The lady here in the second row?
and then you can come up afterwards.
Yeah.
Does PCF work with any other issues other than vaccination?
The Secular Coalition does the Put Kids First program is just for vaccinations.
Okay. I was wondering about like other medically unfounded.
We're open. Actually, the Secular Coalition is also going to take on the American Atheists. Oh, hospitals. When you have Catholic hospitals, for example, who will deny life-saving treatment to pregnant women when that treatment includes aborting the baby, but do not inform the patient of that before they go to the hospital that is a concern. That often happens in Catholic hospitals. The American Atheists is doing started a project to pass a bill to address a patient's right to know act, where the patient has a right to know what treatments the hospital you're attending may reject. And the Secular Coalition is going to work with them on that. So that's going to be a separate push, though.
I was wondering about other trial-related issues like that. Rejections of like
We're always taking on these types of issues. I strongly recommend, if you haven't already, go to secular.org and sign up for our action alerts, and we'd love to have your help. That's it then, right?
That's it. All right. Thank you, Brian. Let's give Brian another hand.